Okay, now we are going to talk about the lateral ligament complex of the elbow. This lateral complex is formed of 4 components. First of all, the annular ligament. The second one will be the radial collateral ligament. The third, the lateral ulnar collateral ligament. And finally, the accessory ligament. So the first one, the annular ligament. Its origin is in the anterior edge of the radial notch. As you can see here, this is the annular ligament. It surrounds the radial head and inserts in the posterior head of the radial notch. As you can imagine, this ligament is very important to assure the stability of the radius.
Welcome to mskfreak.com, a new way to learn MSK Ultrasound. In this website you will find different contents. Chapters in some of the courses, detailed anatomical explanations with amazing high-resolution 3D drawings, lectures comparing the anatomy with the ultrasound images, and finally real-time demos to reassure the concepts. MSK Freak, your website of MSK Ultrasound.
The second component will be the radial collateral ligament. Its origin is in the lateral epicondyle on depth, just distal to the lateral epicondyle, to the tip, and insert in the radial collateral ligament, in the annular ligament. Okay, so this is the second component. The third one will be the lateral collateral ulnar ligament. The lateral ulnar collateral ligament, This one continues with the radial collateral ligament. It's slightly posterior at the lateral epicondyle. It blends with the annular ligament and inserts in the ulna in the supinator crest. This is the most important ligament assuring the stability on varus of the elbow. And the final component is not important, it's not very important, the accessory ligament. It originates in the annular ligament and inserts in the supinator crest again. Now we are going to check the lateral complex with ultrasound, and we ask the patient to flex the elbow 90 degrees, and again in neutral pronosupination. Those are the structures we are going to seek, and this is the first placement of the probe in the same axis as the forearm, and again we will find these structures, okay, like in the first step at the bony contours. You can see here the humeroradial joint, and you can see here the cartilage of the radial head. So we will try to distinguish between two structures. First of all, on depth we will find the ligament complex, and on surface the common extensor tendon. Sometimes it's very difficult to distinguish between those structures, and we need high-resolution probes. If we don't have a good view of if we cannot distinguish between those structures, let's try to go slightly posterior, because here the ligament complex is bigger and it's easier to distinguish. Okay, so here you can see on depth this lateral complex, okay, and have a better view than the common extensor tendon above. And if we try to have a closer look, we will try to find some components of this lateral complex. So again, this is the humeroradial joint, and you can see the cartilage of the radial head at this level, and this small structure, hyperechoic, just surrounding the radial head, that will be the annular ligament. So this is the first component we will search. From the lateral epicondyle to this annular ligament, we find the radial collateral ligament. As you can see here, in this case it's very easy to distinguish the ligament from the common extensor tendon just above. Okay, and what about the lateral ulnar collateral ligament? This is a very important ligament to assess, because it's a very important stabilizer on varus. So it's difficult to find with ultrasound, but we will try. Okay, if we remember the anatomy, this ligament has an angle, a 20 or 30 degrees angle, and we will need to move the probe toward this orientation. Okay, and we will move the probe slightly posterior till we find the posterior edge of the radial head, and we'll need to recognize 3 bony structures. the humerus, distal humerus, the joint line, the radial head in an oblique view, and finally here appearing the ulna at this level. So if you notice all these structures, you need to search for different ligament structures. First of all, the annular ligament at this level, just above the cartilage, and another structure going from the lateral epicondyle to the ulna. And with anisotropy, this structure will be anechoic or hypoechoic. The structure will merge with the annular ligament and will origin in the posterior and deep area of the lateral epicondyle. So this will be the lateral ulnar collateral ligament. The accessory ligament is not useful to search, so we are going to move to the next topic, that will be the muscle and tendons. Thank you very much.
Now we are going to study the lateral collateral ligament complex. First, we place the probe over the lateral epicondyle till we see clearly the corticals of the distal humerus and the head of the radius. To see the ligament complex, you should be slightly posterior at the lateral epicondyle and use subtle movements and anisotropy to try to distinguish the fibers between the tendon and the ligament. So at this level, you can see the corticals of the distal humerus at the head of the radius, the annular ligament wrapping the head of the radius, and between the deep lateral epicondyle and the annular ligament, the radial collateral ligament. Covering the radial collateral ligament, you can see the common extensor tendon. To have a good view of the lateral ulnar collateral ligament is challenging. We need to change the orientation of the probe. It must be slightly towards the posterior direction, 20 to 30 degrees, and located at the posterior side of the head of the radius in an oblique view. And we need to see the more proximal part of the ulna. So this is the distal humerus and the head of the radius in an oblique view, and this is the proximal ulna. Here we can see the annular ligament, and here we can see the lateral ulnar collateral ligament, with origin in the deep and posterior side of the lateral epicondyle, merges with the annular ligament and inserts in the proximal ulna. As you can see, it's difficult to have a good vision of this ligament. Now we are going to check the annular ligament on its long axis. To do so, we place the probe transverse over the head of the radius. You can see the cartilage above the head of the radius and the ulna with the posterior edge of the radial notch. Covering the cartilage and inserting into the ulna, you can see the annular ligament. So this is the posterior insertion of the annular ligament. Above you can see the calcaneus muscle.